We're a specialist service and we work with women from conception right through to a year postpartum. That we're looking to expand upon that. We're made up from a mixture of professionals. We have a full-time psychiatrist, a pharmacist, a psychologist, we have nursery nurses, community psychiatric nurses, an occupational therapist, we have social workers, we have nursery nurses, a peer support worker and a mind support worker. So we're quite a comprehensive team. We work really closely with maternity services, so your health visitors, your midwives, your GPs and things like that, and that's where we get most of our referrals from. So we work with women with a range of mental disorders, ranging from postnatal depression and anxiety and depression through the pregnancy, obsessive compulsive disorder, birth trauma, right through to things like bipolar type 1 disorder and schizophrenia and postpartum psychosis, which are at the more kind of serious end. 1 in 10 women will experience a mental health disorder during the perinatal period, and quite shockingly, suicide is the leading cause of death through that period as well. So that's kind of why we're here, really, to make a difference. Untreated perinatal mental illness can have a really long-term impact on mothers, babies and the whole family going forward. So that early intervention can make a real difference. And the one thing I would say is it's really treatable. So seek help where you can.
I work in lots of different ways with mums, sometimes behind the scenes supporting the staff in the work that they do, but also in some cases I work directly, and that'll either be in a group format or one-to-one. So from the group's perspective, we run a compassion-focused therapy group. So it's a small number of mums, usually about 9 or 10 mums, who meet over 12 weeks, and we just teach them some of the principles of compassion-focused therapy and then help them to apply that. And it's got a strong evidence base to support mums in this adjustment and time around the perinatal period in building up some really helpful resources and skills for managing their wellbeing.
So if anyone's experiencing any mental health problems or any concerns, I'd recommend that they see a professional. So that's either their GP, midwife, health visitor, who can refer into our service. So we accept referrals from any professionals. And from there we offer an assessment and a range of services. So we have psychology, which can be one-to-one services or group therapy. We have a psychiatrist who can offer medication advice and pre-birth planning. So we run a variety of groups. We run a circle of security group for mums to learn about the relationship with their babies and to aid bonding and attachment.
It helps the mums to keep the babies in mind, to look through the eyes of the child, and helps with their connection. So that they get a secure bond with their babies. We get a lot of mums that are really anxious, think they're not doing a good job, so this is a really good way to demonstrate to them that they actually are doing way better than they think. We also get lots of mums who would like some strategies to help them deal with incidents that crop up with their babies, so we can give them advice and support with that as well to help them to manage their babies more effectively and understand their emotions.
We have a walking group to get mums active and out there. It's often difficult and quite isolating being a new mum, so getting out and meeting people really does help.
So I am the mind support worker and I work one-to-one with the ladies. I also run 2 walking groups, and the idea about that is just to get people back out of their house, walking around in nature, and we just do one-to-one talking. So I do run 2 of those a week.
As well as the group, I also do one-to-one support with mums, and that's where that level of input is recognised as being needed. And that'll either be around potentially trauma they've experienced perhaps during the perinatal period, perhaps around the birth, but also it may be that there's been traumatic experiences earlier on, sometimes in early years in childhood, and at other times later on that really the sort of journey of motherhood is sort of pulling on, and sometimes the adjustments of motherhood can bring us back reminders of times that we've actually felt like we'd sort of left behind or forgotten. So I will do some work around that. I'm trained in a number of different models. I often use something called Emdr, which is eye movement desensitization reprocessing. Also models of CBT, which is cognitive behaviour therapy, and as I've said, CFT, which is compassion focused therapy. We also, as a service, and I use it as well, we're trained in VIG, so that's video interaction guidance. So myself, nursery nurse and one of the care coordinators are trained, and our peer support worker are trained. And video interaction guidance just looks at taking some video of a mum or father and baby playing, and then we go back and just sort of pick out the wonderful bits of it really, and then look at that together with mum or mum and dad, and just sort of notice these moments of connection and attunement between mum and baby. And attunement is just a fancy word for saying that connection, that moment when mum and baby are really sort of focused either on each other or on the same thing. And it's a strength-based therapy aimed at really building on those connections and those strengths. So there's a whole host of different things, many I've not even mentioned, that we can apply either collectively as a team or myself individually. And yeah, it's just about coming in and meeting us and seeing what we can do. We offer an individualised treatment plan, so just to sort of meet the needs of each presenting case.
COVID was a really difficult time for our service, as it has been for many services. The impact was great on our service user group, but I mean, maternity services had limitations on partners attending scans and even attending the birth at times. So that was really difficult for our ladies who were increasingly worried about the pandemic, the vaccines. They were isolated through shielding, and they weren't able to spend time with close family members who would normally be there to support them. So that was really difficult. We had to be quite creative and innovative and get our services running online quite quickly. So we developed an online drop-in group for women to attend, so they could come online and they'd know that there was someone there every day or just once in a while whenever they needed to give them that support. We offered Tele Psychiatry, so appointments via Teams, and it seemed to work really well as offering face-to-face visits where clinically the risk was quite high. Since then, we are back to more of a hybrid model. So we are, getting up and running groups, but we are keeping things online for those who prefer it. So around this difficult time, we were fortunate enough to be awarded the South East Region Parliamentary Award for Excellence in Mental Health. And that was a real boost for the morale of our team through the pandemic. And it was a real testament to the hard work and dedication of the team. So just a take-home message for professionals and anybody that wants to be referred to our service, I'd say we have a duty worker that works 9 till 5 Monday to Friday. If you've got any concerns about any of your patients, feel free to phone in and talk to us. We're there to help and not judge.